Hello, my name is Mark Taunton. Today, I'm interviewing to a lady called Lisa Nobes. She's a chief nursing officer for Ipswich and East Suffolk CCG, and she's also on West Suffolk CCG. Thank you for talking to me with me today. Um, so please, can you tell us all about your job and role, and also what is involved? So, hello.
Hello, Mark. It's lovely to see you, and thank you for inviting me to talk about my job. So I've given it a bit of thought about how do I kind of summarize my job to you, and I guess there's two key things that I do. So my job is really to understand how good the NHS services in Suffolk are at providing care for the people in Suffolk. Ipswich and East Suffolk and West Suffolk. I don't cover Waveney, just so you know.
Okay.
Um, so so that involves actually how good is the care at West Suffolk Hospital, how good is the care at Ipswich Hospital, the ambulance trust, our GPs, our 111 call provider, our mental health trust, and lots of different organisations that we in the CCG buy services for the people in Suffolk. So the hospices, lots of organised. I think we've got about 300 contracts with organisations to provide
Okay. Yeah.
NHS care. So my job is to see how good the quality is, and if there are problems with the quality, to look at how I can support them and my team to
Mm.
improve. So for example, there might be a service that's not that people say, oh, Lisa, this service is not giving us what we need. And actually, it's because we haven't given the service enough money. They've run out of money. They've been doing so much work. The number of patients that,
Mm.
we thought there'd be 50 people that needed that service, and they've already seen 200 people, and they've just, they just can't
Yeah.
cope with it. So sometimes what we need to do to help services improve is to give them more money.
Hmm.
Sometimes they need a whole range of different support. So in a nutshell, my job is to understand if the services are good, and where they're not good is to help them improve. Now I get my information from lots and lots of different places. So I have lots of data that tells me different things. It tells me how many patients are using the service, and it tells me lots of data stuff.
Okay.
Listening to people that use the service is really, really important, because they will
Definitely
tell
it is.
you, they will say it's brilliant or it's terrible. And to me, that's one of the most important things to listen to. And then the third thing is, are are the people of Suffolk and patients getting the service that they should? So, for example, if somebody breaks their leg and they go into hospital to have their leg bone fixed, are they getting their leg fixed, and are they coming out of
Mm.
hospital without an infection, with nothing horrible happened to them? So we look at something that's called outcomes for patients. When it's the same with mental health. When people go into one of our mental health inpatient areas, they have a treatment plan, a care plan that
Yeah.
they co-design, and we need to understand if the service is delivering the right care.
So we were just what we do here in Suffolk at the moment, and we're doing this as part of we're doing this as a part of an ongoing thing, but it's also a part of the strategy that's coming up very soon as well. So why do you think it's important to work in co-production?
It's important because only people that use the services can tell us whether they're good services or not, and they know whether how the service needs to improve, and they know, everything that we need to know about the service users know. So we have to work with people, with organizations, with users by experience to develop the services that they may be accessing.
Yeah.
we
Yeah.
I would say, Mark, do we do that well? Sometimes we do that well.
Mm,
Do we consistently do it well? No, not yet. People know what co-production means,
yeah.
but I still think that people get a bit confused with co-production and consultation and think, oh, we'll develop this.
Okay.
Now, will you check it?
Can you just explain to us on the consultation, if
Yeah.
possible?
So co-production is where we sit down and we
Yeah.
think we've got this real problem. How are we going to solve it? And we work together and we come up with a plan and we put it into practice, and then you're involved in understanding whether that service actually delivers what it says it will. Consultation is where I sit in a dark room on my own and I say, oh, I think this is the service that will look good. And I say, Mark, I've written this service. Will you just have a look and see whether you think it's the right thing? And
Yeah.
you're just marking my homework, really.
And that's it. Yeah.
We haven't worked together on the
No.
problem. And so the quality of that will never
Yeah.
be as good as if you and I sat down and said, we've got a real problem here. How are we going to sort it out together?
There we go. Thank you very much. And that's my sort of questions today. And thanks for interviewing with me.
You're very welcome. Lovely to see you.